Kim, where would you like to take this discussion next?
I'd like to go back and touch on something I didn't mention regarding Rex Kocherhans. So after I had made contact with the False Memory Syndrome Foundation and had met with, I don't know if you'd call it a branch, but a local group of concerned parents and others that had some tie-in to accusations of incest. And I had visited with a particular set of parents whose daughter had also seen Rex Kocherhans and had a similar experience of questioning her repressed memories that were coming out. These families were very upset with the therapist, and rightly so, as they were being accused of maybe the worst thing a parent could ever be accused of, having sexually abused their own child or another child. And it was decided, I had no awareness of this until after it had happened, but it was decided that there was going to be a small protest march outside Rex Kocherhans' office. So after I had seen him for this type of therapy, he had moved from my neighborhood. He had moved into a very nice...
Affluent?
Affluent, that's the word. Very affluent area. The therapy business must have been going well, and he moved into a very affluent area. And he started doing practice in a group with other therapists, and I know nothing about that group or what they were targeting, but I do know that that's what he did. And that march outside his office, the people who participated in that march, they didn't want their faces shown because of the stigma of having your name connected in any way to an allegation of incest. Even if you're marching to say I'm innocent and this therapist is incompetent. So they wore the drama masks on their face, and I believe they carried signs with warnings about the therapy that Rex was doing, trying to issue a caution to others. And I had no part in that, but my husband and I, one day, we came across Rex at a home store kind of thing, and I didn't speak to Rex, but my husband did, and he was very angry with my husband. He seemed to think that my husband had set up this march, and asked my husband if he was crazy or what.
Had you set up the march?
I had absolutely no knowledge that it was going to take place, or I didn't know anything about it until after it had happened. So I had nothing to do with that. Another thing, when I left therapy with Ruth Kilpack and started being an advocate for caution about repressed memories, there's a researcher named Elizabeth Loftus. She's known as, she has a fantastic reputation in the area of memory. She's done so much research about false claims and false allegations, and also about false confessions. It's important to keep in mind that sometimes people believe they've uncovered repressed memories, and then they go to family members, and once in a while, a family member with enough pressure has said, "Oh yes, I did do it," and maybe sometimes that is a true confession. But keep in mind that the kind of pressure that was put on me to remember allegations or come up with allegations of sexual abuse, that same kind of pressure, and maybe even more so, can be put on alleged perpetrators. That maybe if you will confess, maybe I won't go to the media. Maybe I won't tell everyone I know that you sexually abuse me. Maybe I'll let you see your grandchildren while we have supervision so you don't hurt them. So keep that in mind.
Even reports where a parent or other person admits that they were a part of some sort of abuse or even satanic ritual abuse can't be taken at face value.
That's right.
Because they can be either their memories can have been pressured or distorted, or they could have been coerced into that sort of statement. Just like a police without supervision can coerce confessions from alleged perpetrators that are false confessions.
Yeah,
but then that means we can't believe anything. I mean, that puts us in a place where we can't ever believe anything. I mean, that's my fear. But keep going.
I think that can be avoided, of never believing allegations of abuse, even ones where someone confesses to it. I think common sense can guide us in this. Say you
and evidence gathering. Right?
Yeah. Say you have elderly parents. There are elderly parents, and they have a daughter who is saying that let's go back 60 years. That 60 years ago, those parents did something, sexually abused. Say the father sexually abused the daughter, and she had no memory of it until she went to therapy. And then in therapy, she started remembering that it happened. So how many years has it been since it happened to her? How many years has it been for the parents from that time period? And I think we're all aware that there are changes to memory as we age. To take those things into account. I'm not saying that every confession by an alleged perpetrator who's elderly has to be dismissed just because of their age or the time that has passed. But there's ways to get corroboration. We have to have a line somewhere where we cut it off.
Yeah, and I'm gonna say something that might be really controversial to some. When we think about Joseph Bishop and McKenna Denson, and the fact that he had recently had heart surgery, and then she interviews him, and even though he had also admitted to the Provo police that, and I even had some people express that concern. It's like, wait a minute, this guy's old. This guy recently had surgery. And so even though we have his audio recordings on tape, or even though he may have also confessed that to the police previously, could that be his own false memory, or could he have been coerced into making those sorts of statements?
Yeah, he was a vulnerable man when he made those statements.
And Sterling Van Wagenen, too, is sort of later on in his life. And, he was being confronted. But again, he admits it. So it's complicated, because I'm not in any way trying to say that Joseph Bishop didn't rape McKenna Denson or that Sterling Van Wagenen didn't molest Sean Escobar. I think when you've got an audio recording of them admitting it, that's evidence. That's pretty significant. But I guess, like you said, we still have to use common sense and gather evidence. That's all I'm saying.
That's right. In whatever direction we can go to gather that evidence. Like when there are court cases, at one time, therapeutic clients with therapy-induced memories, they were suing their parents for cash, or sometimes there were criminal charges filed, and there were criminal trials, and in a court system. Well, sticking with that for a second, from what I understand, that doesn't happen very much anymore. It's averaging about 5 cases a year where there's something about repressed memories. Most of the states have made changes and so that there are exclusions in the ways that repressed memories can be used as proof,
as evidence,
as evidence,
court,
used as evidence. From what I understand, there are about 5 cases now, but what really made a difference was when parents who had been accused started suing the therapist. That's when there was a drop-off in these lawsuits, when therapists started to have to be paying.
Right.
Taking responsibility, at least monetarily, for what they did.
Right. Okay, so protests against Rex Kocherhans. Should we talk about the PACE memo?
Yeah.
Okay.
Let's talk about that.
How did you get involved in that?
Okay. Well, I was involved with PACE and being interviewed by PACE. As far as the connection to the memorandum, I don't know just what my interview with him, what exactly it was about. What happened is that I was contacted about going to meet with some official at the church office building to talk about my experience. I had written down not only what I have in this book that I mentioned earlier, but I had written an abbreviated version of it, and I had submitted it to the church, the Salt Lake Church. I had submitted it to them. The
Mormon Church.
The Mormon Church,
yeah.
To the Mormon Church. I thought that my story, I thought that it was such important information for them, considering how the LDS social service employee who put me in with Ruth had no idea the kind of therapy she was doing, and that she was taking a lot of money from the church as payment for therapy she was doing with women in her practice. And I just, call me a do-gooder. I wanted to help people. I didn't want anybody else to be hurt. And so I wrote down my abbreviated story, and I sent it to them. And then I was contacted and asked to come in to talk. And when I went in to talk, I was with one couple, and I was with a brother and his brother. And with the couple, the husband had been accused of incest, and their daughter had seen Rex Kocherhans for the therapy. And with the 2 brothers, one of the brothers was accused of sexually abusing a child. And
so you're interviewed with others in front of PACE. He doesn't interview. I mean, that's kind of a sensitive thing to have other people being co-interviewed with. That's kind of weird.
It was a pretty large crowd.
Okay.
Yeah, it wasn't like a couple of men.
Yeah.
It was a lot of men, and everybody in the white shirts and ties.
And was this before 1991? Because I think he wrote the date of the PACE memo, as I recall, is 1991.
No, it's after.
So okay. So you were interviewed by PACE. Oh no, it's 1990. So the PACE memo is June 19th, 1990.
Okay, I was interviewed in 1992 or 93.
Okay, so this is
92.
actually after, but by PACE.
But by PACE.
So he's continued his investigations after the memo.
I only can think that's probably likely, but I can't say for sure.
Okay, well, we'll have to correct what we write in the write-up.
Okay.
But you were interviewed by PACE.
Okay. So I go in with this family, and I see that all of these men have copies of that abbreviated story that I had written. And the ones that are sitting closest to me, I can see that they've used highlighter to mark up the copies. And PACE, he comes in after the main group of these men have come in. And he comes in and he sits near me. And basically, he's like, well, what would you like to tell us about your experience? And so it was very tearful on my part, and I kept saying, wasn't it enough? So I was just freshly out of this, and I was saying, wasn't it enough? All that I went through as a child, wasn't it enough to suffer all of that? Why did they have to go and try to convince me that there had to be more to account for the pain and compulsions I had? And what was so confusing about this experience is that I was anticipating that they would feel for me. I was looking at them as my brothers in the gospel. They were big shots in the Mormon church. They were leaders. They were the heart. In my mind, they were the heart of the church. They were the ones closest to Heavenly Father, closest to Christ. They were going to feel my pain. And I anticipated something like this. They'd say, oh, sister, we're so sorry that this happened to you. Would you like a blessing? I anticipated something like that. Or an offer of, oh, sister, I'm so sorry. We're so sorry. How can we help you now? How can we help you? Is there anything that we could do? Instead of that, no one said anything except Pace. And he was glaring at me. He looked so angry, and it didn't make any sense to me. I had no idea what to make of it. And then when I left, I thought, well, maybe they're so holy. Maybe they think I'm going to hurt people by sharing my story. Maybe something like that. Like they were vilifying me too. But it was just very, very confusing.
I'm just looking up his history. So Glenn Pace has a bachelor's and a master's in accounting from BYU. So he's not a mental health professional. He's an accountant. And it says he worked for 2 Big 8 financial firms. So he's a professional accountant, I'm assuming in the 70s and early 80s. And he was a CFO of a land development firm. And then in 1980, he decided to take a job working full-time for the LDS Church so he could focus more on spiritual matters. So anyway, so we know that his background is in accounting, not mental health, which I don't know in this case, which would have been better or worse if he had a mental health background, right? Given what we know about therapists sometimes at the time, but I'm sure most are responsible. But anyway, what we do know is that by 1993 or 2 or 3, he would have already written the memo saying he believed all the SRA claims. And so I would guess he would have been offended or put off by people trying to claim challenging these claims and trying to say that this was a hysteria because he was on record with the Brethren of having been in support of these claims. Mm-hmm. I don't know. I'm just speculating now.
Mm-hmm. Yeah. And I don't know if I was even aware at that time what had happened or was happening in Lehigh. I barely know the details of what happened, but I know it involved allegations of sexual abuse and a lot of people and children and a ward and all of that. So I definitely wasn't there to try to convince him that he had misunderstood anything or.
Right.
Mm-hmm. Yeah, I left there. I anticipated some kind of a follow-up. There was no follow-up.
They didn't offer you legitimate treatment.
No, it was like they had sworn a vow of secrecy. When I was there, like none of all those men in that room, the only one who said anything was Pace, and then the man who initially welcomed us into the room, told us where to sit, and then after we were done, all he said was, "Thank you." I was waiting for empathy. I was waiting for the blessing. All there was Thank you. And then they filed out of the room and nobody said anything else. It wasn't any kind of a church type of experience. It was a shock.
Nothing pastoral.
Nothing.
And this totally is reminiscent of the Chris Swallow interview. I interview someone named Chris Swallow who had been the victim of sexual abuse by Lowell Robinson, who ended up becoming a mission president and then a stake president. And in spite of Chris Swallow and two of his friends/family members going to church headquarters, going to Earl Tingey, who's an attorney, and telling Tingey, a general authority, about the sexual abuse they'd all experienced. Same thing. Tingey had a legal pad. He's writing down everything they say. No compassion. It's all get the information. No attempt at actually providing any reassurance, comfort, and a thank you. You were dismissed now. It's over. And then no follow-up for any pastoral care or treatment. It's almost as if Kurt McConkie trains all these people of how to do a deposition in a way that will gather all the information that could protect the church, but control the environment so nothing could ever hurt the church without any care or concern for the actual victims.
Yeah.
And then just dismissing them to go their merry way and not following up. Because to follow up and provide therapeutic care would be some sort of acknowledgement of guilt or responsibility. And by the way, this therapy of yours, Ruth Kilpack, was referred to you by a Mormon bishop. And so the church would want to be they would be scowling at you and they would be wanting to minimize any risk on their part because, in fact, Ruth, had been referred to you. So,
and that is so very unfortunate. It's so very unfortunate because pastoral care, spiritual leaders, what is their role? What are they trying to accomplish? I cried throughout the whole interview with them. I cried, and I was 27 years old, a faithful young Mormon wife and mother with children who thought so highly of them based on nothing really but their reputation. And they sent me away. They sent me away empty. They sent me away with no comfort. They sent me away with no caring. They didn't want to help me. They wanted to take from me. They wanted my information for their own purposes, but they weren't interested in my welfare. That hurt.
I'm so sorry. So where do you go from there?
Okay. Well, so my husband and I had decided we were going to get on with our lives and hope for the best as far as my emotions and all of that. And the farther I got away from the therapy, the better that I felt. So during my therapy, at some time with Ruth Kilpack, I had a thought come into my head. And it was that, the way that this repressed memory thing works, this reminds me like of the church. And at this time, I was very orthodox, very faithful, would do anything except any calling. I was the one cleaning the toilets when they had church members cleaning the building. I was the one ready to do whatever I was asked to do, and my husband too.
So even though you had this really bad experience with church headquarters in Glen Pace, you didn't just leave the church offended. For how many years did you serve as an Orthodox faithful member of the church?
Almost 30 years.
After?
Oh, no, after. Let's see.
So you're 27-ish when this happens with Pace.
So
what age
I
would
left
you have?
8 years ago.
What age would you have?
And that was about 92. So you do the math.
Okay, I can't do the math, but I'm
Okay.
guessing at least a decade or two more.
Yeah.
You served faithfully in the church.
Yeah.
You didn't get offended and leave.
No.
You stayed faithful and orthodox until some year. What year where you started having an awakening?
8 years ago.
8 years ago, so 2011.
Uh-huh.
Okay.
But throughout my membership in the church, starting in the first year, in the first months of membership, based on what I wrote in my journal during that time that I just have read through again, I didn't think I could leave. I had bought into the idea that I was already in a lot of emotional pain based on my life experiences and my current situation, living at home with my parents. I had already bought into the idea that there was no chance of ever feeling better unless I was LDS. Within, maybe even before I joined, when I was taking the discussions, I bought into that idea. And I saw in the therapeutic experience about the repressed memories, I saw some similarities. Believing that I had repressed memories of sexual abuse was the only way I was ever going to feel better. They told me that over and over and over again, probably at every visit, and that if I didn't remember, I would not heal, which would mean more suffering. Then there's the idea about the authority. So I accepted the therapists as authorities who knew more about life than me, knew more about how to be happy than me, knew more about how the mind worked than me, knew more about my own childhood than me. I did that based on nothing. It was based on nothing. It was based on nothing in my own experience. It was based on what I saw on TV about therapists, things I had read about therapists, assumptions I had made based on what society was telling me about therapists. People who, in my mind back then, people who made fun of therapy, talked about shrinks and things like that, they were like Archie Bunker. They were the unenlightened ones. And I didn't want to be that. I wanted to be good and nice and smart and all of that. Same thing with the Mormon Church. I joined based on nothing. I joined based on what other people told me it was, what other people told me things meant, other people's interpretations. I've come to understand that with the therapy and with the religion, in both cases, it's somebody else's story, not my story.
Joseph Smith's story,
It's
right?
it's Joseph Smith's story about what worked for him.
Stories in the Book of Mormon, stories in the Bible, other people's stories.
Yeah, I'm not talking about literal stories. I'm talking about what they say about life.
Yeah.
You know? And so in the therapy, it was just more of the same. I had no experience with remembering memories and healing. I was trusting authority. I didn't know better yet. I was too young to know better yet. And I guess my life experiences had it. And also the horrible vulnerability of being a victim of physical abuse. verbal abuse, watching domestic abuse, listening to domestic abuse, the sexual assaults type, I don't know what other word to use for it, that I told you about that I never forgot. I was so vulnerable. And I was vulnerable when I joined the Mormon church because I was in all that pain and so lonely. And it was so accepting, just like with the therapy. As I mentioned, Rex, when I would talk during the therapy, he would just gaze at me with a smile, like
the missionaries.
yeah, like the missionaries.
Yeah.
Okay, and I was so important to him, and he told me I was different from the other clients that he did therapy with.
Right.
And the solution with living the LDS gospel, the solution for doubts you have about its authenticity or whether it's good for you, the answer is always work harder. You got to try hard. Are you praying individually 2 times a day? Are you praying with your family morning and evening? Are you doing family home evening every Monday? Are you attending all your church meetings? Are you doing your scripture study individually with your husband and with your family? You're not? Well, then how can you have any expectations that our gospel will make you happy or make you feel safe or bring you peace? You're a slacker. Pick up speed. And that's what I would do. Many times over my 30-year history in the LDS church, I would freak out about things that I would learn had happened in the history of the church, or about attitudes expressed by members, by the church as a whole, attitudes and that. I would freak out, but I always blamed myself. Something was wrong with me. This was true, and I needed to get in line. And this was just, you don't question this. This is just universal truth. This is how it is, period. If you don't get it, something's wrong with you. Well, that's the same thing I did with the therapy. They had the truth. I worked harder. I did whatever they told me. I worked harder. I believed them. I trusted them. I was misled.
So that putting you on that hamster wheel of worthiness and or shame and or hustling for love or healing, you having to do the work to make yourself worthy, so to speak. That hamster wheel of hustling for worthiness you found in the church, just like in therapy, you're saying.
That's right. And it makes me really sad when you say it, that phrase, hustling for love. That still hurts. I took it all so seriously. I really thought it was life or death to believe in the LDS way or to believe in the memories. And I hustled. I really gave it everything. But in the result, the consequences were that I felt like more of a failure. Because in doing everything, I think you can take this back to child abuse. The physical abuse I told you I experienced in that. I think you can take it back to what happens when there's trauma, like I experienced in childhood. What happens to that child? How does that translate into their everyday life, where they feel like they're defective in some way? Why is my mom hurting me? Why are these horrible things happening in my family? I must be responsible in some way. And hey, maybe I can control it. Maybe if I be a good girl, let's be a real good girl, and maybe this'll come to an end.
Maybe they won't hit me.
Maybe they won't hit me.
Right?
Maybe they won't abuse me. Both of my parents at different times had said things about me being responsible for them not getting along and stuff like that. Horrible burden to put on a child, and untrue. And I carried that, and I was so looking for love. And so with hope, I don't know if human beings can survive without hope, and I needed it desperately when I was young, and I joined the LDS church feeling some hope, and then I needed it when I was introduced to this idea about the therapy with the repressed memories. I needed hope that my emotional pain could subside, that I could heal, that I could be whole. And in reality, what happened is that I left it, and I learned how to be an adult. I learned how to take responsibility for myself instead of turning to other people, authority figures or not, and expecting someone else to guide my life or keep me safe. I took adult responsibility for myself, and I learned so many things, critical thinking skills, not taking things at face value. I've learned so much about empathy. I really feel for people, whether they are accused or whether they are the accuser, or whether they suffer from their own decisions. They've made bad decisions and they suffer, like how I did. In the end, I think I have to take responsibility for what happened to me. I was vulnerable. I got into something that was very destructive and could have killed me. There have been suicides related to repressed memory retrieval. Sometimes I thought I couldn't make it when I was doing it. But I think that I have to take responsibility, because in taking responsibility, I am saying I'm an adult, and I'm not going to delegate my behavior, my thoughts, my feelings. I'm not going to delegate them to anybody else, because that gives me the power, that attitude gives me the power to learn and grow in life. Just like in the Mormon church, I came away with the Mormon church when I was doing it. I got the teaching that if you make a mistake, it's big. It's big. If you have sex and you're not married, we're talking big, really big. And it was the same thing with the therapy. You don't remember, it's big. There's going to be big problems. There's going to be a lot of punishment. There's going to be suffering. And another similarity is that those that think differently are inferior or weak. In the LDS church, I remember many times at church people making jokes about people of other faiths, making fun of the way that they saw spirituality. And there was only one way, and that was the Mormon way. And those with different ideas are mistaken. They've been misled. They have part of the truth, but not 100% of the truth, like the LDS people were said to have. Also, that critics are dangerous. With the LDS church, we know you're not supposed to look at anything that might shed some different light on
Provide
life.
Information.
Avoid information, and by all means, avoid anybody who outright says they disagree
Yeah.
It's bad enough if you're doing something else, but if you specifically disagree, then that's really dangerous, and you should avoid those people. So when I was doing the therapy, I turned and the beliefs that came into my mind were about Satan, that Satan was trying to destroy me. He didn't want me to remember. I was always pleading with Heavenly Father to let me remember. So I turned to that concept of Satan, the cognitive dissonance. That is, I would think that listeners could hear that throughout this whole experience, the cognitive dissonance. Maybe people who experience a lot of cognitive dissonance are people who really take integrity seriously, that they take responsibility, they don't want to hurt anyone, and they want to be honest. I've always been a person who wanted to be very honest. Like when I was young, I remember my dad wanting to steal towels from a motel, which was a big thing. I don't know if it still is, but people used to do that. And I remember giving him a lecture. Dad, that's not right. We don't do that. We didn't pay for that. We need to put those back, and unpacking the towels. I've had that kind of integrity in my life. And that kind of integrity, when you're up against two things that you think could be possible, you don't want to make a mistake. I know it's more than just about integrity. It has a lot to do with fear of punishment, fear of how you could be hurt if you make the wrong decision. You have to think perfectly, make the perfect decision. The risk of losing identity by participating in either one of those things. My identity that I had before I joined the LDS church, boy, I became what I was told, what Heavenly Father wanted me to be. I married young, at 19, had children, was pregnant within like 2 months of marrying. I had a 4-year full scholarship to university. I surrendered that to follow the goals that were given to me through the LDS church, because I trusted them more than I trusted my own thinking, my own heart. In the Repressed Memory Therapy, of course, I've repeat this again, I trusted the therapist more than I trusted my own thinking, than I trusted my own heart, but not enough to surrender to what they were demanding I had to surrender to. So something won there. You know, what won that I'm going to have to ponder that. You know, something outweighed something else in all of that. And I think it was love. Mm-hmm. Yeah, I think it was love for my family, love for fellow human beings. Mm-hmm.
And hopefully for yourself.
And for myself.
Yeah.
And the idea of vilifying those that leave it, that happens in the LDS faith. And
in some of these conspiracies.
Yeah. Mm-hmm. Yeah. And the recklessness with power. I look back about things that I learned through conference or the Ensign and at church and that, the lessons. I look back at some of those and I think how very reckless, how very reckless and how very arrogant to mess with people's lives like that, to say their own opinion, to present their own opinion as Heavenly Father's will or God's will, and threaten the punishments associated with not accepting accepting it, and how reckless, like what has happened with the when they weren't going to baptize the kids that had a gay parent or whatever. How reckless is anybody taking the time to possibly count the cost that might happen with some of these directives that have been made throughout. Did Joseph Smith ever take the time to count the cost about what would happen to a young orphaned girl who he was telling her that she was meant to be his wife, and the pressure? Who's counting the cost of all these bold proclamations? And who's going to take responsibility for them? We know that Oakes has said there's not going to be any apologies. They don't need to apologize. Well, why not? Why not? When people are hurt, what's wrong with apologizing? How is that Christian? I don't understand that from a Christian viewpoint, but I do understand it from an ego and a power and a money viewpoint. No one has apologized to me with those therapists that I saw. Neither one of them ever apologized for anything that they said or did. They went on doing their thing. Ruth made plenty of money. I know she bought a TCBY franchise, looking for places to put her money. And I know that it was Aspen something therapy in Provo, over on Center Street in Provo. I know that clinic goes on. Ruth had after her marriage to the bishop, she became a life partner with her another woman that was also a therapist at the same Aspen something therapy. That therapy practice goes on. I have no idea what they're doing there. So we learn to follow our own hearts, follow our own minds. We have nothing else. There's nothing else in this world that can supersede our own sense of what's real in our lives. That's been a big lesson for me. I'm happy now. Miracle, my husband and I, been married 36 years. We're happily married. He's the light of my life and my best friend. I came out on top. I survived this nightmare. It's a cautionary tale. Be an adult. Think. Do your own research.
Beautiful and so powerful. And yes, I'm looking up Aspen Therapy, aspen-therapy.com, and there's a picture of Ruth Kilpeck. It says she's retired, but for some reason
she's died.
She has passed away. Did either Ruth or Rex apologize to you?
Never.
And did any of the bishops that referred them to you apologize?
The bishop that got the referral from social services, he said that man from social services said that he was sorry that he referred me, that he wouldn't have if he had known what she was doing.
Okay. Did that feel like an apology or an acknowledgement or something?
It was a validation. I got that shortly after saying I wasn't going to be going anymore, and got the newspaper article, and that it was a validation. But my, oh my, who's overseeing things? Who's making sure that things are done in a way where people aren't being hurt? It comes back to the individual.
Right. And it sounds like, I mean, I want to say, how did you heal from all this? But if I had to summarize, you're basically saying, don't give your power away. Don't trust anyone who claims to have absolute authority. Don't trust any one narrative as the absolute truth. Use evidence and data and critical thinking to guide your way. Trust more in your own strength and resources than outsourcing. Mm-hmm. Assemble your own identity instead of allowing someone to hand an identity to you. That's what I'm hearing you say. Anything else you'd say to survivors of abuse?
Yeah, self-acceptance. I think.
Don't buy narratives that make you feel worthy or worthless, and that everything's huge and that you're bad. Keep going. Sorry.
Yeah, I like where you're going with that, John. Yeah, self-acceptance. And I think that a crucial part of developing self-acceptance is getting out in the world. The more that I've mixed with other people, when you come from a trauma background, there's a tendency to want to isolate yourself and be afraid of people and not know how to interact with people. But the more that I have gone out and taken on risks and challenges, and I've had the point brought home to me that everyone has issues. We're all just human. Perfection isn't what it's cracked up to be. That imperfection can actually help us to bond with each other, to feel for each other, help each other, care about each other. If everyone was perfect, that wouldn't exist. I think that's God-given. I think imperfection is God-given to help us to draw toward each other.
So kind of lower the stakes in terms of you're catastrophizing mistakes, have self-compassion, self-love, and don't hustle for love, right?
Yeah, and a big issue for me was the idea of not being judgmental. When I read that in my journal from that first year of being a Mormon when I was 17, boy, it was pretty dramatic that I felt that I had to, there's that thing about accepting other people as they are, but also knowing how to have a boundary, to talk therapy talk, how to say, I don't like this. I don't want to be part of this. I don't like you. I don't want to be part of being around you. Or I disagree. We'll have to agree to disagree, but I don't have to agree with you and please you so you'll be nice to me, so you won't hurt me.
Right. So be aware of ethical boundaries, ethical standards for mental health professionals. Read up on those codes. The APA, the American Psychological Association, has a ethics code. The American Psychiatric Association has an ethics code. Marriage and family therapists, licensed counselors, licensed clinical social workers, they all have ethics codes. Become aware of what ethics codes are for mental health professionals. Hold them to high standards. Know what dual relationships are and what appropriate boundaries are, and become an educated consumer about evidence-based therapeutic approaches to mental illness, which is why I spent 6 years getting a PhD. I don't practice psychotherapy right now. I do some faith crisis coaching, which is not therapy, right? It's just like, hey, you're having a faith crisis. How do I help you get through that? That's a very different thing than treating trauma, treating eating disorders, treating depression, treating anxiety. I don't do that because I'm not licensed to do that. I'm qualified to do that. I can do that, but I don't do that because that stuff should be done under the rubric of someone who's licensed, but not just licensed, but well-trained and professional and competent, and someone who has a good reputation and who adheres to all the best practices, not only of the ethical codes, but also of empirically supported treatments that have evidence behind them as efficacious treatments for legitimate psychological diagnoses.
And when you're feeling, a person is feeling down, low, oftentimes they don't have a lot of energy. And in feeling anxious, a lot of times it's hard to concentrate. But for one's own welfare, one has to take responsibility and not turn it over to the therapist, has to research, because even though there are evidence-based practices, the key is in following how it's supposed to be administered, how to do the techniques, how to do the therapy. And therapists don't always stick close to the guidelines in doing it. They can break off. And if you educate yourself, you'll know more, not perfectly, but maybe enough to be able to make an educated decision about what's happening to you. I have just a couple of things. Expectations of therapy: to be empowered, to see your life and relationships improving, to have less emotional suffering with time, or better able to cope with what you have to accept, and resolving problems, or accepting what is. That Courage to Heal book that I mentioned, and the workbook, which are the Bibles of the Repressed Memory Movement. In there, they talk about how it might take years, how you might stay in the suffering state of therapy for years before you feel better. I don't believe that. I don't believe it.
It probably helps therapists buy nice cars and yogurt franchises, but it probably doesn't lead to healing, right?
Right.
Yeah.
Yeah, and it's dangerous.
Yeah. Super dangerous, yeah. I received a message from a therapist that doesn't want to be named, and she writes, hey, John, good job on your SRA coverage so far. If anything ritual has ever happened and there is evidence that can stand investigation and prosecution, we would all be concerned, meaning mental health professionals. But I've never seen it in 14 years of child abuse investigation and treatment. I've seen thousands of cases of sexual abuse with lots of evidence. Thousands with lots of evidence. And few of these cases had forgotten memories beyond the preschool age. So again, she is saying that people tend to remember their sexual abuse. So we just, and then they go on to write, I've had clients with dissociative identity disorder diagnoses, but it is rare, and none of them have had SRA or recovered memories like are common with satanic ritual abuse. But then, they go on to write why they're not wanting to use their names. She writes, I'm careful of being public in my skepticism about SRA, as the advocates for it will demonize you if you show doubt and claim you're part of the conspiracy. They will claim you are part of the conspiracy. And so and finally, she writes, it's hard to disprove a conspiracy to the person who believes it. Yet we have an obligation to seek truth and follow evidence, especially when facing those who refuse to do so. So, again, it's like conspiracies happen, follow the evidence. We all care about abuse, but we have to be responsible. And we need to talk openly about this because it affects people. Well, Kim, I can't thank you enough for your willingness to spend 5+ hours with us to talk about this super important issue. You're courageous, your integrity, your wisdom. Thousands of people are going to be blessed by your willingness to tell these stories. And my hope is that at a minimum, people become better educated about these things. And for whatever spectrum of sexual abuse or ritual abuse that is not legitimate, that your story will help people look at those cases and be able to identify the signs of illegitimate or non-credible therapeutic techniques or evidence or accusations of abuse, right? And so for that, I just can't thank you enough for coming on Mormon Stories.
Thank you. Thanks for visiting with me. Thanks for your work. It's making a difference.
Thank you. Thank you. And for all of you who claim to be victims of satanic ritual abuse or ritualistic abuse within the church, for all of you who are supporters of people who claim to be victims, we want to hear credible stories. We are not here to just show one side of this. I know that you're going to be hesitant because, we interviewed Dr. David Frankfurter, who's an expert on claims of satanic ritual abuse. And we started with that because we don't want to be guilty, like I said, of perpetuating or advancing more hysteria. And we want to be informed in a broader context. He had never studied Mormon satanic ritual abuse. So all of his information was based on evangelical Christianity and Catholicism and, satanic ritual abuse claims going back all the way to 200 AD in the Roman Empire. Like, that was outside the Mormon context, but I felt like it was responsible to start there to set the context and the frame for the history of these sorts of claims, even outside of the Mormon context, but also within. So I know that SRA advocates or supporters or alleged victims are going to be frustrated that I started there. I felt like that was responsible. And then I also started with Kim next because Kim was one of the first people that reached out to me. And we actually met face to face. I vetted Kim and she vetted me, just like I will be vetting people who claim to have SRA experiences. I will be vetting you. I want you to vet me. But I hope that people who feel like they have credible evidence-based claims won't be scared off by the fact that we started with skepticism and information, and even with some, critical perspectives on dissociative identity disorder, on hypnotic techniques, on satanic ritual abuse, on these sorts of claims. And I don't think anybody is going to be able to accuse me of being a shill for the Mormon Church, of me being part of some Mormon, conspiracy to cover these things up. I'm not. I have no stake in this game. There's nobody that's come to me and said, either way, you need to do this, or, hey, let's have some conspiracy. There have been people coming to me who have said, John, I'd love you to cover satanic ritual abuse as people who are supporters of the claims. And I've told them I will do it, but I will have to do both sides. But I'm not anyone's puppet or pony. And I think Kim made it really clear that she left the Mormon Church a long time ago. Her final testimony certainly is not showing anything like sort of being a shill for the Mormon Church. So for all the conspiracy people out there, this is not about a conspiracy to cover up any claim anywhere. And we're certainly, again, not telling victims that their stories aren't true. What we are doing is trying to do an objective, honest, open look at this situation. And so now I am publicly calling for therapists, police officers, victims or family of victims, if you have claims rooted in evidence that are credible, I want to hear about it. And we want to have you tell your story, but just know we're going to have a review of the evidence or whatever evidence you have, because the last thing we want to do is perpetuate a hysteria or falsely accuse somebody and wreck lives as a result of someone's false claims. So that's what we hope we're going to be providing with you. In addition, for this series, we will be interviewing Sandra Tanner. We'll be talking about the Glenn Pace memo in depth. And we hope to interview proponents of SRA in whatever form we can, if they're credible. So that's how we're going to continue the series. Thanks for joining us. Please spread the word. Thanks for everyone who supports Mormon Stories Podcast. If you support this type of programming, please donate at mormonstories.org. 10, 50, $100 a month, whatever you can afford. We're a tax-deductible organization. We're transparent in our finances. All the money goes towards supporting these types of stories and communities, people like you. So please support us, and thanks to everyone who does support us. And please spread the word about this series to anyone you know who might care, because the more feedback and information we get, the more good we can do. So thanks for joining us again. Kim, thanks for everything. Thanks to your husband, John, as well, pseudonym John, and for his support. I'm so happy for you, your marriage surviving, you guys thriving, and we're again so grateful for you coming on.
Thank you.
Take care, everybody, and thanks to Cody Layton, who is our video and audio producer and engineer. He does great work for us, and we have to thank him. Take care, everybody, and we'll see you again soon on another episode of Mormon Stories Podcast.